If you are here to learn how to fix your lower back pain, then I have a special surprise for you. Because I have not one, not two, but three brand new ways for treating your lower back pain that's better than physical therapy and backed by science. Adam here from trainingmassage.com. The first treatment is designed to get rid of what I like to call the shoelace effect. If you take a look at a regular shoelace, you will notice how most of them have shoelaces that are woven in three directions. You have part of the shoelace that goes across, and then you have two other parts that go at roughly a 45-degree angle. And when you tie your shoes up nice and tight, all three of these will create tension, which then secures the shoe to your foot. But what would happen if only one side got tight? Or if only one side wasn't tight while the other two were? Well, you would either feel tightness or uncomfortable in one part of your shoe, or you're going to feel like your shoe is about to fall off. This is the first reason for your lower back pain. On your lower back, you have what's called the thoracolumbar fascia, or TLF for short. Have you ever seen that white stuff on your lower back when you look at anatomy books? That right there is your TLF. And this fascia acts just like the shoelace. You have multiple fascia layers going in different directions on your lower back. And because your fascia wraps around your muscles, if it gets tight or stiff in one direction or another, then it can actually create tension in the rest of the body. And it's this tension that's most likely pulling on your joints and your muscles, resulting in your chronic pain. In fact, we have several studies that shows releasing your fascia not only helps relieve your lower back pain, but also helps improve your lumbar mobility, and it's better than physical therapy. This study took 102 people with lower back pain and split them up into two different groups with standard physical therapy and myofascial release. And what they wanted to see was how much improvement they had in both their pain levels and their mobility. And what they found was that not only did myofascial release outperform physical therapy at every level, but they also got those results much faster. And just so you understand this, let's take a look at the conclusion of this study. And I quote, "The generalizable findings of this pragmatic study indicates that when the fascia system is addressed to those with lower back pain related conditions, regardless of diagnosis, gender, age, and chronicity, the outcome appears to result in significant pain reduction and perceived benefits with improvements in quality of life compared to standard physical therapy practice." End quote. And you may be asking though, that's great and all, but how do I do this if I can't find a fascia therapist, someone who can work on that? And luckily, the answer is most likely in the back of your closet. What I'm talking about here is a foam roller. And we have not one, but two different studies that show using a foam roller on your lower back actually improves your thoracolumbar fascia mobility. And just for fun, here is another study that shows using a different kind of fascia release technique called Graston, or scraping basically, also saw similar improvements in the thoracolumbar fascia to those with foam rolling experience. So pretty much what that's saying is, it doesn't really matter what kind of fascia release therapy you're doing or using on yourself, a lot of them are going to see similar effects. Now, if you didn't know about these studies, then make sure to hit that like and subscribe button, because it's here where I'm going to show you the concepts behind these studies and how you can apply them. Now, later in the video, I'm going to be giving you a complete treatment for you to go through that's going to show you how to release the fascia in your lower back. But first, we need to go over the other two methods that most doctors miss, with the next one being a very controversial opinion, and that is releasing the psoas muscle. When your psoas and even the fascia around it becomes short and tight, thanks to you doing things like sitting all day, it can not only pull on your lower back and the muscles in there like the quadratus lumborum, but it can also create issues like anterior pelvic tilt. Now, most doctors are going to sit there and tell you that this muscle is just too deep to release, but they are all wrong, and I'm going to give you three quick reasons why. Number one, your abs are not as thick as you think they are. If you're going to take a look at the bicep or something, this is a thick muscle when you take a look at it from the side. Your abs are nowhere near this kind of thickness, especially at the angle and the spot that I'm going to show you where to go and enter the body. Number two is, yes, you have some organs on top, but very specifically, they are the intestines. And if you approach it slowly and go in it and follow along with the body, then you will be able to bypass the organ very easily because it'll just slide out of the way. And finally, if you actually gave it a try, you would actually be able to feel your psoas contract when you lift your leg off the ground, because the only muscle in the stomach that controls the hip, that creates hip flexion, is the psoas muscle. Meaning, if you feel a muscle contract in your stomach region, you know you're on the psoas, or at least the fascia on top of it. Now, just in case you're still not convinced, then check out this study that shows once again, a comparison of physical therapy to a myofascial release, but this time on the psoas and the diaphragm. And guess what? The myofascial release once again came out on top as being the superior treatment for lower back pain. And as a byproduct of this study, they even show that the fascia release improved the expansion of the chest wall, which is the whole other issue I'm not going to be getting into this video. Now, to be clear, this study did take a fascia release plus physical therapy group against physical therapy alone, and they found that the fascia release did have better results than the physical therapy, even though they had less treatment. Now, again, I'm going to be showing you how to release your psoas later on when I go through the treatment plan. But now let's look at the final reason why you most likely have lower back pain that most people are not taking into consideration. And that is that your joints are out of balance. Now, to understand what I mean, you first have to understand what I like to call the balance joint principle. In order for the body to move optimally, the joints need to follow a specific alternating pattern of mobility and stability. And to understand this, let's just take a quick look at a skeleton. Starting at the bottom, you can easily see that a healthy individual should have good mobility in the ankles, especially with how much the ankles are able to move. Now, if we take a look at the joint right above that, like the knee, we can see that it's mostly designed to move in one direction. And I say mostly because the knee is able to do a little bit of rotation when the knee is bent. But for the most part, that knee is designed to be stable. It's also why it's usually a career ender when you have a knee injury, especially in sports. Now, going up the chain, we now have the hips. And again, the hips are designed to be mobile. Just look at how much mobility and range of motion and different movements you can do with your hips versus your knee. Now, when it comes to the spine, you can easily make an argument that is designed to be mobile versus stable. But if you focus on, let's just say, how physical therapists try to treat lower back pain, what they're trying to do here, they try to exercise the muscles around the lower back, like the core and the QLs, for example. Well, all this is designed to make your lower back stable, which in this case kind of does help with my principle, considering that the joint right below that is considered mobile. Are you starting to see the patterns here though, right? Now, excluding the spine, let's just quickly finish this up. If you take a look at the shoulder joint, once again, we have some mobility. If you take a look at the elbows, we have some stability. And again, if you take a look at the wrist, mobility. We have this stability and mobility alternating pattern throughout the body, which allows us to move the way we do. So how does this relate to your lower back pain? Well, when one of these joints isn't able to do its job, let's just say the hips lost their mobility, then the body is going to look for that mobility in a different spot in the joints right next to it. And in this case, that's going to be either the knees or your lower back. What this means is if the hips become more stable because they get tight and they lose their mobility, then your body is going to look for that mobility somewhere else, meaning it turns those stable joints mobile, resulting in an easier way for them to become injured. Now, sadly, I couldn't really find too many studies on this particular issue, but I do have a lot of experience treating people with lower back pain by specifically addressing their hips first. By giving the hips the ability to move again, it gives the body's ability then to want to make the lower back, the core tight again. That also helps with the exercises that you usually do when you go to physical therapy. So now that we have gone through the 3 different ways to treat your lower back pain and why you get it, let's go through the number 1 treatment for your lower back pain. Now, to get started, you will need something like a foam roller, a massage ball, a 5-inch ball, and even a yoga block in order to get started. And the first muscle we're going to be attacking here is going to be the latissimus dorsi, also known as the lat. And the reason why we are going to be releasing these muscles is because they attach directly into your thoracolumbar fascia, which means if they get short and tight, which is most likely when we're on computers all day, then it can also create tension in your lower back. resulting in your pain. Take your foam roller and begin slowly rolling out your lats by laying sideways on a foam roller with it on your back more than on your side. Now that you're on your lats, begin slowly rolling back and forth. Your goal here is to release the lats for 90 seconds up to 3 minutes. And you can either do this in one round where you're just hanging out in the muscle rolling out for 90 seconds, or you can break it up into 3 different sets of 30 seconds each. And remember this because this is going to apply to the rest of the muscles that we're going to go through. And next up, we're releasing the diaphragm and the psoas because just like that study shows, by releasing these 2 muscles, we're able to improve lower back pain. So with that said, let's start with the diaphragm. Get started by getting into a seated position as you lean over and place 1 to 2 hands under your rib cage. Once there, grab the ribs and gently move them up and down towards the feet and towards the head, following the rhythm of your breath if you're able to do it. Now, if your body allows you to get deeper as you're working the muscle, then go ahead and follow along with the body, moving only as your body lets you get deeper, meaning don't try to force it, let the body let you in basically. Again, do this for 90 seconds up to 3 minutes each side. Now to sub-massage the psoas, start off by laying on your back with your feet planted and your knees bent. The area you're going to be targeting is going to be below the belly button and on the 2 edges of the 6-pack, the rectus abdominis. What you're going to do here is grab your lacrosse ball and place it on your 6-pack. From here, take a yoga block and place it on top of the ball in order to add leverage. And as you do this, as you press into the stomach, make sure you're going in at a 45-degree angle, kind of towards the spine basically. Now move slowly because it will be uncomfortable, especially if you've never done this before. And if you're not sure in the right position, then lift your leg up in the air to see if you're on the psoas or not. Now, once you believe you're on the psoas or close enough to it, go ahead and hang out on that position and take in big deep breaths for 90 seconds to 3 minutes. Here we are using the big breaths while we're holding pressure as a way to massage it. So as opposed to you moving the ball back and forth, we're letting the breath do the movements and massage the area. Now another muscle that creates that shoelace effect in your lower back is going to be the glute max, which is why we want to work on it next. To release your glute max, begin by sitting on top of a foam roller, focusing on one glute at a time. From here, slowly begin rolling out the glute max, trying to cover the entire muscle from the top of the pelvis to the bottom of the tailbone. Again, do this for 90 seconds to 3 minutes. Now from here, go ahead and tackle the glute medius, which is on the lateral side of the hips. In order to do this, simply roll to the side of your hips and work on that smaller portion just below the pelvis, but right above your hip bone. For this muscle, you can either hold static pressure or you can do micro movements by moving back and forth and side to side. Now, next up is going to be the quadratus lumborum, also known as the QL. And again, this muscle can get short and tight, not only thanks to the psoas and the diaphragm getting tight because they are fascially connected, but it may also be tight thanks to the crosslinks of the shoelace effect, thanks to the thoracolumbar fascia. To release the QL, start by laying against the wall or on your back on the floor with a ball in your lower back and to the side. Now from here, start applying pressure into the lower back, but go into the lower back at a 45-degree angle. This is going to allow you to get a little closer and angle it towards the spine. Now, once you're as far as you're able to go, rotate now so that your back is flush against the wall or the floor in order to begin working the QL. For this muscle, you can either hold some static pressure there or just do some small micro movements by moving back and forth and side to side for 90 seconds up to 3 minutes. Now, these next 4 muscles all contribute to tight hips and again can limit your mobility in your hips, which then makes your lower back take the brunt of the work. The first muscle is the tensor fasciae latae, also known as the TFL. To release the TFL, go ahead and lay on your quads, but from here, simply shift to your side a little bit aiming for the muscle right where your pocket is. You can confirm you're on the muscle by simply rotating the leg back and forth, and you'll feel the muscle pop in and out. Now, once you're on the muscle, go ahead and either hold some static pressure or do some micro movements for 90 seconds to 3 minutes. Once you're finished with the TFL, go ahead and tackle the quads, the muscles right in front of the legs. Stay in that prone position as you place that foam roller on the top of your quad, and then slowly roll all the way down to above the knee and go back up. The idea here is to slowly move back and forth. And for this, you can either do this for the full time, or you can use it to search for a tender spot within the muscle and then work that with some static pressure or micro movements. Again, your time limit here is however you want to use it, and you can do whatever techniques you want during this time. Next up is the adductor group, the muscles on the inside thigh. In order to begin releasing this muscle, stay in that prone position, but now kick your leg out to roughly 90 degrees with the knee bent as well. Now from here, place that foam roller underneath your adductor, going in the same direction as your body is. Now from here, you again slowly roll out the inside leg, starting from the inside thigh and then moving out towards the knee and then back. Or you can do some static pressure techniques or some micro movements, whatever you prefer. Now from here, we can move into the hamstrings. All you have to do is get into a supine position and a seated position basically on the floor with a foam roller underneath your hamstrings. From here, slowly begin to roll out your hamstrings from the bottom of the glutes to the back of the knee and back, looking for the most tender spot. For this, you can then apply some static pressure or some micro movements, again for 90 seconds up to 3 minutes. So how many times should you be doing this treatment? Well, go ahead and try to do this every day if you have the time for it. Otherwise, do it every other day for a few weeks and see how you feel. Chances are 1 to 2 times and you're already going to feel a huge difference. Now, chances are as you begin to work on these muscles, you're going to find a lot of tender spots, and those are most likely trigger points. And if you want to learn why you get trigger points and how to properly release them, then make sure to click on the video in the top right corner. I'll see you over there.